The obesity epidemic rages, and today every sixth person is obese. One of the few effective methods of fighting obesity is surgery. Previously, it was thought that people lose weight after surgery because the stomach has less space for food. However, new research shows that people lose weight for a completely different reason. The goal is now to recreate this effect by using a pill.
These surgeries are expensive to perform and they come with a lot of surgical risk, and the patient needs lifelong vitamin substitutions and control of doctors. The optimal goal for us is to fully understand the mechanisms behind these favorable effects in order to mimic these changes without doing the surgeries.
In a new study, researchers investigated the effects of two common procedures: the well-known gastric bypass and a relatively new procedure, sleeve gastrectomy.
So the two procedures are anatomically very different, but on the clinical parameters, the two procedures seem to perform alike with respect to weight loss and diabetes remission.
Gastric bypass changes the gastrointestinal anatomy so that food flows directly to the distal part of the small intestine and bypasses most of the stomach. A sleeve gastrectomy removes most of the stomach, leaving a narrow passage for food through a small tube.
When they were designed these operations, people were thinking of restriction. That's what we usually call it, If you make a very, very small pouch, as I told you we do, then of course you cannot eat much because there is no stomach to receive all this food. But that turns out to be completely false.
They therefore developed an alternative theory.
If you bypass a larger part of the intestine, then you cannot absorb the food. You will have malabsorption, as we call it. That turns out also to be completely false. So what is it then? What happens after the bypass operation is that the secretion of these hormones is incredibly increased. 30-fold increases is what we have observed.
In this study, the researchers tried to understand the mechanisms behind the favorable effects of the two procedures.
There is one hormone where we have a particularly clear distinction, and that hormone is called ghrelin. It's a hormone from the stomach, and one of its effects is to increase appetite. It increases in concentration before the meal intake, and as soon as you take in the meal, then it decreases again.
A bypass operation increases the secretion of the appetite-inhibiting hormones GLP-1 and PYY. Sleeve gastrectomy has almost the opposite effect.
After sleeve, these hormones are not very much increased. Instead, we have a decreased secretion of hormones from the stomach. For example, the appetite-stimulating hormone ghrelin is completely suppressed after gastric sleeve.
Both gastric bypass and sleeve gastrectomy cause most people to lose considerable weight and eliminate type 2 diabetes. In the future, the researchers hope to combine the different effects of these hormones to provide even more favorable clinical benefits.
Our ultimate goal is to mimic these changes without doing the surgeries. If we can utilize some of these hormonal changes that we see after surgery in new medicine or something like that, that would be the optimal goal.